she has told me not to really talk so much about that. You can see everything on screen, but she's a very eminent speaker in the field of ONG that I can say. Ladies and gentlemen, over to you, Dr. Pramila.
So nice. I look so much taller. I wish this was real life. Hi, good evening. It's the end of the day. Aren't you all tired? Sorry that I've got to talk about shit at the end of the day, but that's what the topic is all about. So now, I think we had a beautiful lecture just now, and that's from the gastro point of view about how to deal with acidity, changes in bowel. And I'm going to talk to you about a gynecologist's point of view. And I think, I know that my topic is battling constipation, and that would apply to both males and females, but I've got a very female-dominated talk here, basically because constipation happens more in women rather than men, and it happens more in pregnancy, and so that's going to be my angle for today. So now all of us have been constipated. Tell me one person here who's not been constipated. Anybody? Yeah, because the reality is that once in our lifetime, or many times in our lifetime, we are going to be constipated. And I'm not talking about other constipated issues, but I'm talking about bowel constipation. It's really very common. It's as common as about 20 to 30% of the crowd. The Malaysian figures actually said 16.2, but I tak percaya, I don't believe this one, because I'm sure that that's actually an underestimation. Now, when we talk about the fact that how do we define constipation, and here we are going to talk to you about constipation without a major organic problem. Okay, we're just talking about simple constipation. Now, when we define it, we talk about the fact of less than 3 bowel movements per week. We talk about the fact that, in more than 25%, you are straining to pass motion, or you're passing lumpy stools, or you have a sensation of incomplete evacuation, obstruction, and even sometimes having to use manual maneuvers to take out the feces. So any 2 and above and more than 3 months, that's what constipation is all about. And as I said, very much more common in women. And we'll go through why it's very much more common in women. So now, I'm not going to go into a very busy slide, but I'm going to say that the most commonest reason for constipation is, I don't know. Sometimes it happens. And sometimes, and especially why in women, is because, unfortunately, the stress levels are much higher. The acidity is much higher. They have more eating disorders. They have more pelvic floor dysfunction, especially after childbirth, pregnancy, and let's not forget after delivery. Very commonly, they have bowel problems. And most of us, women rather, have more slower transit system in the body. And maybe in terms, again, going back to diet, we are looking at insufficient fiber intake. So if you really look at many of the causes of constipation, in many senses, as a pharmacist, you can actually tackle a lot of it, and we will tell you how to tackle that. Now, again, going back to in pregnancy, and I want to tell you that do not ever forget that woman who comes to you after delivery. Because we tend to focus on pregnancy, and we know that constipation memang in pregnancy is so common, and we help them through that. Talk to them about after delivery. Because after delivery, they might have had a normal delivery. What happens with a normal delivery? You've got hemorrhoids and piles. You might have had stitches in the perineum, not comfortable to pass motion. So, to be very honest, when upon discharge, most of us actually give that woman a stool softener to take home because we don't want her to be constipated after delivery. So if they do come in, or if the poor husbands come in and say, please help my wife, then think about that stool softener that you need to give her, because it is really very, very important to help that particular woman. But why is constipation so common in pregnancy? So we know we have the estrogen hormone that goes up. We know that we have the progesterone hormone that goes up. Now, these two hormones feed that pregnancy, feed that baby. But that progesterone is that naughty hormone. That progesterone slows the body down. So all that peristaltic movements slow down. So that's why that nausea comes in. That's why they get that blocked. The feces cannot flow as it goes down. And that's why they get that constipation. Not only that, you have that uterus that's pressing on all those intestines there. So in many ways, that becomes like a mechanical obstruction. So again, constipation. Diet might be different. They might not be drinking enough water because they want to go and pee. They might be taking a lot of supplements, and especially since we obstetricians are very, we push on the multivitamins, the calcium tablets, the iron tablets. All that can then lead to constipation. So a lot of things can actually predispose that pregnant woman to constipation. Also the fact that she may not be moving so much, especially that first 3 months. All the chirita will come in, cannot go up and down the staircase, cannot bend down to pick up everything. And here we are telling them, please move, you must move. Because when you move, your intestines move, and that actually helps you with all your bowel problems. So coming back to how do we treat constipation? And so here you have a lady coming to you or her family member coming to you and asking you, how do we treat constipation? And it's not just giving that stool softener or telling them how to use it. That's one of the biggest things that you have to do. But I'd like you to spend a little bit of time to educate that woman or her family member that fluid intake has to go up. It's really very important. 2 to 3 liters per day. But again, that depends on how the Malaysian weather is. So if you had the weather like we had about 10 days ago and it was so hot in this country, you have to then up the fluid levels. If that day someone goes Zumba exercises and sweats a lot, we have to increase the water level. So it is all about that balancing of input and output. So caffeine is great, but it dehydrates. So again, what we do tell you is that if you can do it in such a way, 1 cup of coffee, 2 mugs of water, to be very honest, to balance the input and output as such, because you do not want to be dehydrated. So water is really very, very important. Secondly, are we taking enough fiber? Did you have enough fiber for your lunch and tea just now? The only thing I could see that was closest to the fiber was the scones, closest lah. So do we get enough fiber in our diet? And all of us are guilty. We are all guilty. So, unless you actually have a fiber drink. So the typical Malaysian food, your roti canai, your dal kari, your nasi lemak, does not carry enough fiber. So what is fiber? How much of fiber do we actually need? We actually need about 25 grams of fiber per day, and that's not easy. Yeah? That really is not easy, because of the fact that that's equivalent to 13 slices of bread, 8 oranges, or 5 cups of broccoli. I will probably prefer swallowing that fiber in different ways, because of the fact that if I'm looking at bread and calorie intake, then I would say definitely not. Okay, so that's the amount of fiber, and you need that fiber, because that fiber and the water, what happens is it increases that bowel movement, helps you prevent constipation. And the good news about fiber in the diet is the fact that it actually helps with other things like cutting down the cholesterol, the diabetes, and all the NCDs that come in, the overall gut health. And many of you might know that I do a lot of menopause talks, and now we are incorporating fiber into the menopause field because women, especially older women, do not take enough fiber. So very important to incorporate fiber. So if you're going back to pregnancy again, fiber supplementation in pregnancy, really very important, because we do know that it definitely helps with that bowel movement. So what can she take? The vegetables, the fruits, the simplest to take. Whole grain, bread, nuts, so anything that she can incorporate into her diet to ensure that her bowel output is good. So whether we are pregnant or not, a lot of us actually take supplements. I'm also very guilty. I take my calcium, I take my D, I take my minerals. But sometimes for some of us, and again, we cannot generalize. Every one of us is very different. Sometimes how we take these minerals and the supplements can actually cause constipation. And the biggest culprits are the iron and the calcium. All right? So how do we take it and how do we prevent constipation? So again, when that woman is pregnant, this becomes even more significant. When that lady or family member comes to you with the fact that they are constipated, ask about whether there has been any new supplements introduced in the last week or in the last month that can contribute to constipation. So talk about changing, cutting down dose, dividing the doses, changing the timing. So trying to suit that person. So that fact that they need the supplement, but trying to get them the best way of taking those supplements, which are really very, very important. And I like this. The person who actually taught me about this is not any books or anything like that, and this is my own son, because he always has that little stool, next to him or in front of him when he's in the toilet, and he says it saves his life because of the fact that he's got a lot of bowel issues. And we know that sitting upright with your knees, and very clearly said, if your knees are higher than your hips, it actually makes that whole angle when you're pushing much, much more easier. The pubic muscles are much more relaxed, and you don't have to strain so much. And that is what we want, because we know that when that person strains, it can then lead to hemorrhoids, and that is really something that we are trying to avoid. So water, we talked about supplements, we talked about fiber, we talked about sitting right. But the next few areas are the most important. So let's talk about probiotics. I know the conversation came in with the gastro, but I will talk to you about probiotics from the woman's point of view. And as I said, probiotics for a woman who is getting older, probiotics for a pregnant woman, because I think this is really very important. Probiotics, good bacteria, and we know that probiotics work by releasing enzymes which absorbs nutrients. Number one. Number two, it goes and lines that gut. So when it lines that gut, it forms a barrier, so against all the pathogens, so that barrier comes in. And on top of it, it also fights the bad bacteria, and so the balancing of the good and bad bacteria come in, and that ensures a much more healthier gut. So many studies have been done, and we know that there have been a lot of studies about probiotics and constipation, all working in a positive way, reducing the gut transit time, increasing the stool frequency, improving the stool consistency. And this is our first line, actually, for a lot of our pregnant ladies, to get them to get probiotics, because we know that in pregnancy now, there is a lot of other benefits to probiotics, because it is also cutting down the risk of IgE immunities, like, for example, passing over eczemas and allergies to the fetus. So a lot of good things that are coming in about probiotics. What kind of probiotics? So when we are talking about the main probiotics, there are so many types. But we are talking about the bacillus, we're talking about the bifidobacterium, we're talking about the lactobacillus. Lactobacillus, again, something that is very common when the gynecologists talk about the vaginal health. The same lactobacillus is also found in gut health. So again, getting the good bacteria to flourish and trying to get away the bad bacteria. But there is also another terminology, which is the prebiotics. And for some time, everybody was getting confused. What's probiotics? What's prebiotics? So basically, in the most simplistic way, the prebiotics is feeding the probiotics to make the probiotics much more stronger. So it gives you that oomph and gives that, so it basically energizes that probiotics so it can work much better. So the prebiotics can be non-living stuff, and it can be available as food supplements. It can be available as what is written out here, onion, leek, garlic. But it can also now being sold, I know, in all your pharmacies as prebiotics to strengthen that probiotics. But what it does, it just has a synergistic action to make those probiotics better. So now we go on to laxatives. And what I'd like to talk about are the three main laxatives that we are looking, the types that we are looking at are the stimulant laxatives. So as the name suggests, stimulant. So it works to increase the gut motility, and the feces is then passed. The osmotic, basically by increasing the fluid content. And finally, the bulk, so the bulk of the feces gets more, and then it gets passed on. So what we are going to be talking about one by one, and let's start off with the bulk-forming laxatives. So when you're looking at the bulk-forming laxatives, so bulk-forming, so it retains the fluid, increases the bulk, and then the stools then goes down. So not absorbed by the GI, safe in pregnancy. The only downside, it takes time. Sometimes takes 1 day, 3 days, and if you already have fecal impaction, it's already really blocked up, this is not going to work. You need to pass it because of the fact that if you take that bulk, it just gets more and more stronger inside there, but that initial part to come out does not come out until you use something else like an enema. So bulk, great for long term, but it's a slow release. But what do you have as bulk? You can have all the diets that you have, which is like husk-filled food, wheat bran, all that would be bulk. Now, stimulant, like I said just now, it stimulates the GI tract. So quick action, so you have that quick action and then you pass the feces. Now, what is the downside to it? If you think about someone who is pregnant and she is third trimester, you don't want things to be so fast for them, huh? Okay, so you want it to be slower. So you don't want to give it to someone who is close to delivery. You don't want to give it, so technically we'll tell you not the third trimester. So don't give it to them in the third trimester. Sometimes what happens is the fact that it can cause a lot of pain. So we have to be very careful about that. Sometimes after that, it causes a lot of diarrhea, but great for that initial bulk that needs to come out. But then you need to think about what's long term. So in that sense, I'm sure I don't have to tell you what you have in your pharmacy. You may have all the agents which are stimulant laxatives. But what we are going to talk to you today more and more is the osmotic laxative. So osmosis, drawing in the fluid into that feces, making that feces bigger, more volume, more softer in consistency, so easier to flow down. And many of them actually have got indigestible sugar, and that ferments and may sometimes give you that little bit of excess gas, sometimes a little bit more gassy, flatulence. And the great thing is that many pregnant women actually feel better with this. And it is very, very safe to take in pregnancy. It doesn't matter if they have got diabetes in pregnancy because it does not alter their sugars. And they actually like taking a little bit every day, and that would actually help them have a better stool output. So that's what we are talking about today, which is lactulose. So let's talk a little bit more about lactulose. Now, it's probably the bread and butter in your pharmacy. Many women would come and get that, or you would introduce it to many men, women, children especially. So again, containing synthetic sugar, it goes right down to the colon unchanged, only a marginal absorption, and it works not only as an osmotic diuretic, but it also, osmotic laxative, but it also works as a prebiotic effect. So let's talk about the osmotic effect. So we talked about the fact that it goes into the colon, reaches the colon, minimal absorption. It actually draws in all the fluids there, and because of that, it also encourages the peristaltic movement, and the stools are much more softer. On top of that, you have the prebiotic effect. So it is an ideal nutrient as a prebiotic to feed that saccharolytic bacteria, which is the healthy bacteria. And when that balancing of the good bacteria goes up, the proteolytic or the toxin-producing bacteria come down, it rebalances the gut flora, and that too then helps with that gastric transit, and the feces there then comes out. So basically a dual action in that sense. It also works as a probiotic because you know that the Clostridium in the ileum can actually cause constipation. So lactulose goes and displaces that Clostridium. And because of that, it actually works again to balance up that gut flora there. Lots of studies, and we also know from personal experiences, definitely improving the stool frequency, definitely improving consistency, so very much and very, very safe for everyone. It is also good with the bacterial count, and we know from studies that over a period of time, the bacterial count actually increases, and again, working well as a prebiotic and a probiotic. How do I give? I know what the books tell you, but I always start off small. The reason is that sometimes, once in a while, we'll get someone who has got more of that distension because of the gas-producing effect. So I always start off small, and I always will say 15 mils and then build yourself up from there. And again, I'm talking about women, and I'm talking about pregnant women. So I always like to start off small. And to be very honest, from personal experience, that small dose is enough. It's only maybe in about 10 to 15% of the crowd that I might have to increase that dose of to them maybe twice a day initially to get them going, and then play around with the dosing later on, maybe after about a week. So most times a small dose is enough to get everything going. So the great thing, which is what I like about lactulose, is you don't have to take it every day. After some time, though, everything gets better. You have a carryover effect of about 6 to 7 days. You can always go back to that whenever necessary. The only downside, sometimes they will come back and tell me, it's so sweet. But I said, don't worry, it's not going to disturb your sugars in your body, so you can take it quite comfortably, so not to worry about that. And again, to talk about pregnancy, very, very safe, good tolerance, good reliability, good stools, and the fact is that they find it very, very simple to take. So what I tell my patients is one of your best friends during pregnancy would be to have lactulose by your side. Now I'm going to end up with the next few slides, which is to talk about fiber. And again, we did start off by saying how fiber is very important, and all of us are lacking fiber, all of us, unless you take that amount of fiber which I showed you just now. Now, there is Cerbrex NutriFiber, which is also available, which can work in tandem with Dufalac. So what happens is the fact that this is a sachet, you can mix it into water, you can mix it into food, and it has got no taste, so that makes it much better. And on top of it, it is sodium and sugar-free, so much more safer. How does it work? It actually goes into the small intestines, into the large intestines, and basically then improves that stool consistency, and that makes the stool come out much more better. So increasing the bulk, increasing that fiber inside. So again, I'm not going to go talk about studies, but just to say that it not only helps with the consistency of the stools, but it also helps with increasing the probiotic, prebiotic effect in the intestines, and again, improving gut flora, which is what we are looking at. You can take up to, the recommended dose, if you don't take any fiber, is 25 grams. So that means 5 sachets. And honestly, not everybody is going to take 5 sachets, but we can take about 1 to 2 sachets just to improve our fiber content. And that, in addition to all the other foods that we take, might be just the trick to get the feces going in a good way. So mixing it into food, drinking it in drinks, very, very healthy and very, very safe. So when I talk about constipation again, and I just want to recap what we just talked about, I think it is really important because patients, women, men come to you first. And what kind of advice you give them is really very, very important. And I wanted to just go away from the fact of, just talking about dispensing. I know you want to sell that product. I'm sorry, but I always like to look at a very holistic view. And I always say that because you are the first liners, maybe we should talk about hydration. Maybe we should talk about diet, supplements. What's changed for them in the last 1 week or 1 month that has made them more constipated? You might have an older person who has got altered bowel stools in the last month or so. Maybe they need a referral to see a gastroenterologist, because when you're older and there is altered bowel movements, it is very important they get a gastro checkup done. So advising them in how to go about it is actually very important. I believe probiotics are really important, but if they can get the good bacteria from the diet, supplement it if they can't with whatever products that we have, is really important. But constipation is a life-changing, very impactful situation because of the fact that if we cannot pass our stools regularly, it really destroys us because everything gets blocked up. And it can cause a lot of pain, it can cause a lot of misery. And that's where you would come in to talk about how to get that gut health healthy and how to have regular bowel movements, which I think it is very important. So I hope at the end of today, you can actually then think about how to deal with that constipation and then not stop there, but then how to go about keeping their health, gut health healthy, and talking to them about fiber and everything else that you have learned today to keep them actually very gut well. Thank you very much.
Thank you, Dr. Premita. A very good session. Nice to end with, a very informative session on constipation, and she has really, walked us through to the different, ways on how we can handle it. Okay, and I really echo Dr. Premita that, because public comes to the pharmacy firsthand when they, want to get something for the constipation. Of course, now you have a lot of information, you have to do some simple assessment and ask them some questions about the hydration. And if you feel that it's something, like how she said, it's elderly and all that, a referral to the doctor is also something that you can, do, besides actually knowing how to actually recommend which product, which I think today was very, very comprehensive. Let's go to the questions. You all have asked a lot of questions, and I think we have time to take the questions here. Is there a best time to take fiber? Is it in the morning or at night before bedtime?
We can take it anytime, especially if you're talking about the fiber drink that we have here. Just mix it into food. So that makes it much easier because it is tasteless. You can mix it into your drink, you can mix it into your food. Actually, food's much better because, sometimes when you drink, you may taste it a little bit, but food's much better. Actually, when I got the samples, I tried it out in the food. Didn't feel any difference, and I think that's the best.
That's the best. So I think I'd like to also add to the finding from the National Health and Mobility Survey, right, from the Ministry of Health. We found that actually Malaysians are not having enough fiber intake. That's one point that's also from a large survey. So I think I also wanted to ask Dr. Premita, so even, if they do not know how much fiber, because not everyone can quantify how much fiber they're taking the whole day. They're going eating out, eating at home, and all that, right? So there's no harm if they just take a one sachet.
One or two sachets a day,
yeah,
which
it's
is
okay,
fine.
right? If you're not sure, right? Just
some of my patients actually take it at night at dinner because they'll remember it, and it becomes they just take one sachet, they put it into their food and have it at night, because sometimes we are working lunchtime, we don't remember. Breakfast is always on the run, but dinner is generally at home. Yeah,
Yeah,
so
I was attracted what you said, our breakfast, typical breakfast like roti chana and our other breakfast like nasi goreng and all that, very leaning towards carbohydrate, I think.
we are
Yeah,
very, very carb.
yeah, very
We are
carb.
very, very
Like,
carb.
I mean, if you talk about English people, breakfast, they do have some meat, some vegetables and all that, right? And yeah, so
Yeah, my
we
conversation with a lot is now how to eat food,
yeah,
actually.
yeah.
And I
Even the
always will
dal,
say,
dal you say maybe have fiber, but it's a bit diluted.
but dal
Yeah,
has got protein, which is great.
yeah,
But the dal also gives you gas.
yeah,
So when you're talking about, again, I'm very woman-centric, so,
yeah.
I'm looking at from a gynecologist point of view, dal's great, but many women get very bloated.
Practical reason lah.
Yeah, and
Yeah.
pregnancy, again, it's
Yeah.
something that makes you more bloated and they actually don't like it.
Yeah. Okay. Hi, Dr. Premita. Can lactulose be taken in long term in adjunctive with dietary fiber with enema for elderly with chronic constipation?
Actually, I don't see why not, but if you remember one of the slides which says it has got a carry-on effect, so you can actually play around with it. But I do know that a lot of women, again, so all our guts are different, and I think we need to understand that. So there are lots of women, and men, again, sorry, I'm very women-centric, so who have got longer gut, and they're just born with a longer gut. And because they have a longer gut, there is more absorption as the food goes through. And these are people that are going to have chronic constipation throughout their lives. So yeah, you can take it, but I would suggest playing around with it because it has got a carryover effect. You can take it for 2 weeks, then take it off, go back onto it again. So there's no harm. And even though I like fiber, and I like what there is in that fiber, but I will also be the first one to say if everything diet is better. Your own natural fiber is the best. But the problem is that we cannot achieve that amount of fiber. So it's like how I talk about calcium. Your dietary calcium is the best, but we cannot achieve that much. So we then have to supplement. So always look at diet first, then we look at how much we need.
Yeah, we can't all eat the 13 slices of that wholemeal bread, which I was shocked. So yeah, we do need some supplements. Okay. So another question is how to prevent bloating that comes with certain probiotics, because I know sometimes they can tolerate some brand, like, I mean, I don't know whether we can mention
Again,
brands here, but yeah.
Again, all of us are different, and having that open mind is very important. So I think, again, probiotics help bloating because it helps constipation and gut transit and all that. But again, it does not fit everybody. So changing, find something else. Some women can take the sachets. Sorry, I keep saying women, but some take the sachets, some take the tablets. Personally, I had to move 3 probiotics before I got one that suited me. And sometimes it suits you for 3 months, and after that, it doesn't suit you anymore. And I think that's something that we have to be very, very open about. And the good thing is that you're in the pharmacy, you've got so many millions of probiotics there, so you just have to move from one to the other. But I would like you to look at the contents of what the probiotics is all about, where is it going to be very effective, and go evidence-based. And that's what it is. It's evidence-based medicine, where you're looking at the kind of probiotics, and like what I gave you today, it's evidence-based. So you're going to start off with evidence-based first, and then individualize that for that person who's walking into your pharmacy.
Okay. So, yeah, this also was running into my mind. Somebody's asking, can natural yogurt be taken instead of probiotics that contain certain strands of lactobacillus for vaginal health? Yeah.
I mean, I did say about diet,
Yeah.
but I will also talk to you about women and their gut and bloating, because I need you to understand that a woman who is getting older, above 40, and the hormones are changing, the interesting thing is that when her estrogen levels are going up and down, when she is in the perimenopause, that estrogen does not, so estrogen is very important for gut. So it keeps that peristaltic movement going, but progesterone comes in the other way. So when that estrogen level changes and the progesterone levels change as a woman now goes into perimenopause, gut transit changes. A lot of women come in with bloating. And we now have to look at the fact that perimenopause is also inflammatory. So I know I'm going in a different direction, but I thought I just wanted to tell you that bloating in the perimenopause is very important, and we talk to them about diet. And one of the first things we cut off is dairy. Dairies, I call it the SPM diet, huh? The susu, the pedas, the minyak. Okay? One of the first things we actually cut is that, and even things like dal, sambar, the cauliflower, the cabbage, the broccoli. So you're giving them clues. I'm not saying that every woman cannot take, but she now has to keep a food diary. So you'll find that a lot of women in their 40s actually have got a lot of disturbance in their system, and bloating becomes one of the most common issues. Now, recently, I just brought out a paper about what are the top menopausal symptoms in this country amongst working women. Number 5 is digestive issues and bloating. So many of our women actually complain about that. And we start off by making them eat right, because this is the time they're all putting on weight, they're eating wrong, they're going on IF, all the fat diets, talking to them about eating correctly, what to eat, how to eat, and then trying to get them better, which is really important.
Yeah, in relation to that, our natural fibers like the broccoli, cauliflower, potatoes, and all those things, right?
Unfortunately,
Yeah.
sometimes at this time does not work
Yeah, they
very
also
well.
cause bloating, you know, and I think I know of some patients, they want to eat that, but they feel like if they bite big chunks and they don't, so they just cut some small pieces, like very small,
Yeah,
minute
so they
pieces, and
change it a
they
little
try to actually they shred it so that they can eat
Or
it.
shredding
Yeah,
it makes it better.
so yeah, they do different
But it's
ways.
very interesting how,
Yeah.
age and diet and all
Yeah,
that comes
yeah,
in.
especially elderly, I see that they do. Okay, can an infant below 6 months use enema for constipation?
Well, I'm not going to answer that. Sorry.
Yeah, yeah, it's a wrong person to ask. Okay, okay, this is question about a brother, but let's just attempt to see. My brother, over 80 years, just had a cyst removed and he was constipated after that. He was prescribed Ducolax. In your opinion, is Dufalac a better choice?
Well, Dulcolax is stimulant, so that would
Stimulant.
happen quickly. So it now depends on whether after that he's still constipated or
Yeah.
not. Sometimes when you go through surgery and all that stress of that, you may not pass motion. So if they continue to be constipated, then lactulose will be great for that person.
So I think as what you mentioned earlier, so when the stool is already there, it's just hard to come out. Then
Yeah,
a
you need a stimulant,
stimulant is better, right? Yeah. Does usage of lactulose plus fiber cause a diarrhea?
I'm not saying cannot, can. Because of the fact that sometimes it's that fine line with
Yeah.
every individual. Because we do know that sometimes if you take lactulose daily also, it can do the gut and then you can cause diarrhea. So that's the idea of playing around with it. So if it comes to that point, stop it, watch and see. If you need it, go back on it again.
Okay. Okay. Two last questions. Can a pregnant woman with a gestational diabetes or a diabetic overt diabetes take lactulose? Of course,
Thank you,
it's
because
not absorbed.
that's a really good question.
Yeah.
Many of my own patients who are diabetic would ask me the same thing, and I'll tell them it's safe because it gets unabsorbed and it goes into the colon. So it is very safe. They feel that they cannot because it's so sometimes sickeningly sweet,
Yeah.
but actually they can take it.
We have to tell them because people think that anything that's sweet actually it's worse for diabetes, right? But they do not know the mechanism that it's not absorbed, right? So we have to stress to them. As pharmacists, you have to really tell them. Okay, we have come to the last question. Between lactulose and PEG, which one will you choose for constipated patient, and what is the maximum dose for PEG?
Well, I don't usually deal with PEG so much, but because I think the gastros usually deal with it. As I said, I think most of the gynecologists, obstetricians, most of our data comes from lactulose, and we are actually find that it's more palatable for the patients, and they actually feel better with it. And it's a choice again, isn't it? In the sense that I'm not saying that PEG is bad. and what is comfortable for that doctor and what is that doctor's experience with that patient. So, and having a choice is also great. Because sometimes when when it doesn't work, lactulose doesn't work, then you can go to PEG. Having that choice, I think, is really great.
Okay, thank you, Dr. Pramita, for a wonderful last session of the day. Please thank Dr. Pramita in our usual manner. Thank you. Okay, ladies and gentlemen, as promised, we will dismiss by 5. So